It costs nothing to be kind, and it may even save a life. September is National Suicide Prevention Month. Our Charity Johnson spoke with a local mental health expert and law enforcement on ways to help, and she joins us in the studio with more.
Yes, I spoke with Community Counseling Services in Lowndes County, and they said that lending a listening ear can make a world of a difference. When life becomes overwhelming, it can sometimes feel that all hope is lost. This month, agencies across the country are spreading awareness and educating the public on how to help prevent death by suicide.
It is a major health crisis, and we have to treat it like a major health crisis.
Veronica Harrison is the Lowndes County Administrator for Community Counseling Services. If you're with a person who is struggling, she says one of the first things you can do is listen.
Sometimes they just need you to hear them without judging them, without telling them how you would do it, how they should do it. Just hear them and let them know it's okay. If a person needs your guidance or advice, allow them to ask you for it. Don't always throw it in.
The Mississippi State Department of Health says suicide is the third leading cause of death for people ages 10 to 24. Half of that age group are adolescents. Harrison says children being exposed to difficult things in an early age can sometimes contribute to poor mental health.
Trauma happens earlier. Children have distinct needs just like adults. They have things they're facing. Peer pressure's harder.
She says social media can also have negative effects on mental health. She advises creating a safe space for children to express how they feel. However, for any age, she says there are some common signs that point to someone struggling.
Someone has been completely depressed and down for a long period of time, and all of a sudden they're extremely elevated. That's sometimes a trigger.
Drastic changes in moods or behavior are also signs. The Columbus Police Department has been learning how to handle those experiencing a mental health crisis. The crisis intervention team has been in effect for 5 or 6 years.
And with CIT, we're all about showing compassion, all about showing empathy. And I think with that type of tool on your belt, it certainly helps the officer and also the person who is in the crisis.
The CIT involves a 40-hour class led by MSDH or Community Counseling Services. Captain Kennedy Metters agrees with having a listening ear.
The most important thing that we learn to do is to listen. We listen to what the person in crisis is doing. We call them consumers. So we listen to what the consumer is saying, and we ask them questions. And basically, it's not just to give me a yes or no answer. It's an open-ended question. Tell me how you're feeling. You tell me what is going on.
He says their goal is to get them into a crisis stabilization unit. They also take them to the hospital to see if they need evaluation or further help.
Check in on yourself. Check in on your friends.
There are 8 CIT officers at CPD. They have 1 on each shift. If you are in a crisis, Harrison advises getting professional help or talking with a trusted friend or family member. Telling your story in Columbus, Charity Johnson, WCBI News.
And today, September 8th, is also 988 Day. 988 is the National Suicide and Crisis Lifeline. If you or someone you know is struggling with suicidal thoughts, you should call the Lifeline and reach out to your community's community counseling center.